here today, not because she's found anything, but she wants to know the warning signs and any information she should know about breast cancer in order to protect herself. Hi, Tessa.
Hello.
I understand you're here to get some information about breast cancer?
Yes.
All right, and you have no symptoms, no signs of anything right now?
No, just wanted to know what's going on with the strong families.
I understand. All right, well, breast cancer is no different than any other tumor in your body in that all tumors start with a change in the DNA of the cell. What tends to happen is that cells have a change, and usually our immune system will go after the cells that may have a change in it and kick them out and get rid of them. But if for some reason that cell, a single cell with a change in the gene, escapes the immune system, then it can start to multiply and you can get into a situation with a tumor. There are two kinds of tumors that start in the breast, and one is a non-invasive carcinoma, and that refers to a tumor that just goes into the ducts and the lobules of the breast. And there's also an invasive carcinoma, and that occurs when the cancer goes beyond the lobules and the ducts. Or other areas of the body. We call it metastasis. The estimated time for a tumor to become a palpable as a mass that you feel in your breast is actually 5 to 9 years. It's a long time. So it's sitting in there and it's growing very slowly. When the cells do become invasive, they grow in a regular pattern, sort of a sunburst pattern that spreads out, and it can be felt more like a poorly defined lump or just a thickened area in the breast. As the tumor continues to grow, there's fibrous tissue, it's like a thickening, scarring that occurs around the tumor. And there are ligaments that go through the breast. They go through different areas where they attach. Once these Cooper's ligaments start to shorten as a result of breast cancer, it will pull the skin tight in some areas. So you'll see a pitting that starts to happen or a dimpling where they attach. More advanced tumors will start to interrupt the lymph flow in the breast, and you'll get some localized edema and maybe an appearance like an orange peel, little bumps, little indications. If left untreated, advanced cancers can actually get to an ulceration of the skin, the seed, and actually come to the surface. That's fairly far along those cancers. The cause and effect of cancer of the breast, it's a very complex process. It's not as clear-cut as smoking, the connection between smoking and lung cancer. It's a combination of genetic factors, which you have, hormonal factors, everyone's body is a little bit different, and then environmental exposure to toxins and such. Okay. Do you have any questions so far?
Not yet.
All right. I'm going to bring in my other two colleagues, and they're going to talk to you a little bit about risk factors, how you can avoid, how you can also discover cancer. Okay. Nice to meet you.
Hi, Tessa. Hello. I'm Megan. I'm a nurse here, and this is Courtney. Hi.
Hello.
So Heather tells us you have some concerns about breast cancer today.
Yeah.
So I just want to go over a few risk factors that you might want to be aware of and look out for regarding breast cancer. Some basic ones, and you're 35, right?
Yeah.
So your risk goes up after the age of 40. If you have any personal history with cancer, have you had any previous cancer experiences?
Not me personally.
And also, not having children, actually, there's a correlation with breast cancer, not having So be really proactive about contacting your general practitioner if you do notice anything different.
Okay.
So do you think you remember 2 signs or symptoms you could tell us that you would want to report to your healthcare provider?
So any lumps, changes in the shape or size of the breast, any changes in like the skin texture.
Yeah, that's right. Good. So I have some self-care strategies for you, things that you can do to help, things that you can do to help maybe reduce your risk of developing breast cancer. Some things you can do are to increase your exercise. So physical activity, 45 to 60 minutes, at least, 3 to 4 times every week. Try to limit your alcohol intake. I know that's hard, but, one a day, try to drink no more than 1 a day. Maintain a nice healthy body weight. That's really important. Another self-care strategy is, I know you don't have children now, if you do decide to have children later and you're able to, breastfeeding has been shown to reduce the risk of breast cancer, so that's something to think about. You're going to want to get clinical breast exams. So that's when your doctor physically inspects your breasts. You want those yearly after the age of 40, and for you right now, at least once every 3 years for your age. You're also going to want to get yearly mammograms starting at age 40. Now, since you're at a higher risk with your risk factor and family history, it's probably a good idea to talk to your healthcare provider about getting early detection and mammogram screenings, just to start off early and get a good start on things. That kind of covers it. Can you tell me 2 self-care strategies you might try?
So getting a clinical breast exam every 2 years, increasing my exercise, and trying to limit the alcohol.
One thing I'm going to talk about is a self-breast exam, and I have a pamphlet here that shows you how to do a self-breast exam. They're a little controversial right now, but so some studies say they're beneficial, others say they aren't. But as long as you are familiar with your baseline, I think it's a good idea to do it once a month. You do it in the shower. There's also here some